again, now there are 4 medical schools in Israel, and up until 4 years ago, only Ben Gurion University in the Negev, being in the periphery, put emphasis on admission to medical school, not only on scholastic achievements. And I'll give you an example. There are 70 vacancies in each class in medical school in this specific university, the Ben Gurion University Medical School. There are 1,500 people competing on these 70 vacancies. So what they do there is that they take the 50% of the 1,500, the 750 candidates with the highest scholastic achievements, and then they say they are all equal. And they select the 70 based on personality traits. How to judge these personality traits is a big question. So personal interviews by few interviewers, and there has to be a match between the impression of the 2 or 3 interviewers. I will not go into details. Suffice it to say that in order to filter out from the medical profession those whom I call congenital antipaths, you have to start in admission to medical school. Well, I know that it's a little bit funny, but when I talk about compassion, I don't know if all of you know the dictionary definition of sympathy and empathy. These are 2 different terms. By empathy, which is a much stronger term, the sympathy. In order to be empathic, someone has to have the ability to identify genuinely, deeply, with suffering of a patient, to be able to go under the skin of a patient and to feel what the patient feels. Now, this is a very young crowd. I don't know how many of you were patients in a hospital. I hope that none of you. I'm much older than you, and I'm also privileged not to have been ever a patient in a hospital. But I work in a hospital all my life, and I know that when a patient crosses the doorstep of a hospital, he or she suffers from anxiety, from severe anxiety. And in order to identify, really to identify, not only declaring to identify, but to feel what the patient feels, and to identify with this sense of anxiety, you have to be born with certain traits. And these traits are very difficult to check upon admission to medical school. They are objectively very difficult to assess, and sometimes the young candidate for medical school is not ripe enough in order to demonstrate these qualities. So you go on and you have to make a decision. So I'm a director of a hospital for the last 23 years, and in order really not to work with people who do not have the right traits in terms of being able to utmost compassion, you have, as director of a hospital, to accept very difficult decisions. And these difficult decisions, including not giving tenure to someone who is a very bright physician, an excellent physician, who performs in the operation theater superbly, but he is such a congenital antipath who is unable to demonstrate real empathy. Now, not all hospitals do it. I can give you examples, and I'm very curious to know if Cedar-Sinai puts the same emphasis. I believe they are, because you have the name of doing it, but in order...
We have no tenure.
You have no tenure. That's even better. But, so in Israel, we give tenure after 7 years. I mean, it's 5 years residency, and the surgical profession is 6 years, and then 2 additional years. But tenure is also, it's not a Catholic marriage. You can send away a tenured physician too, but to my mind come many, many examples of physicians who were extremely bright, extremely good in their professions, but in terms of their social abilities, they were lacking, and we send them away. Some of them are leaders in various other hospitals. So when we talk about promoting compassion in modern medical care and discussing the Shaare Zedek experience, Actually, when mistakes were done upon admission to medical school, we tried to correct them later on during the career of the physician, whether it's a he or a she. And it takes, I think, great courage from management of hospital to send away physicians who are excellent in every aspect of their medical career except their personality. But I have no regret, and again, because of confidentiality and discretion, I would not bring names of physicians who started in Shaare Zedek and really rose to international, national and international fame, but they did not fit the spirit of the institution. And if you do the same with the nursing staff, you get a hospital that is famous for its compassion, for its humane, individualized care, and actually, and I know I'm saying it with all due subjectivity, but this is our banner. I invite all of you to, when you visit Jerusalem and you take a cab, interview the cab driver about the hospitals in the city, and 9 out of 10, and I did it many, many times, making sure that the cab driver doesn't recognize me, 9 out of 10 will tell you that both Hadassah and Shaare Zedek are excellent hospitals, but in Shaare Zedek, compassion is emphasized in a way that doesn't characterize other hospitals. So that's as far as compassion goes. I would like to say a few words about coexistence, and that probably will conclude my 30 minutes. Jerusalem is a mixed city. Again, for Americans, your society is also a melting pot, but in Israel at large, and in Jerusalem in particular, the population is really mixed, and the ethnic and cultural groups vary. Roughly speaking, if you take the 800,000 people that live in the greater metropolitan area of Jerusalem, I'm saying roughly speaking, and I'm going to give you the distribution, not only the ethnic, but also the cultural, and you will understand immediately what I mean. Roughly speaking, 1/4 are ultra-Orthodox Jews, 1/4 are Arabs, most of them Muslims, 1/4 are modern Orthodox, and the last quarter are secular Jews, because Jerusalem is the capital of Israel, and most of the civil servants who work in governmental office and most of the academic community of the Hebrew University are secular Jewish Israelis. The patient distribution in Shaare Zedek, that again was founded by modern Orthodox Jews in the 19th century, but in the bylaws they wrote that the hospital will run an absolutely non-discriminative approach towards patients and staff. And again, it's not a big innovation, because I'm unaware of any Israeli hospital who discriminate against staff or against patients. Everybody admits everybody, and everybody employs everybody. But Jerusalem being a mixed city, I do believe that the hospital, in a way, serves as a haven for coexistence. And I'll bring you 2 examples. We serve as a national referral center for pediatric nephrology. Doing dialysis to a 2-week-old baby is really an art form. In our pediatric dialysis unit, most of the patients are either Muslims, they'll give the reason in a minute, 70% are Muslims, and the other 30% are mainly ultra-Orthodox Jews that did not do any prenatal testing. Why is it so prevalent among the Arab population of Jerusalem? Most of them live in villages around the city, and they marry within families and internalize some bad genes like primary hyperoxaluria and other bad genes that lead to kidney disease and failing kidneys at a very, very young age. By very young age, I mean that may be born with kidney failure or develop it within days to weeks after they are born. If you enter our pediatric dialysis unit, and just to remind you, you cannot do a kidney transplant to a baby who weighs less than 10 kilograms, around 22 pounds. And there is retardation in development of these kids, so as opposed to a normal healthy baby that weighs 10 kilograms when he or she are 10 months to 1 year old, they get to be 10 kilograms when they are 3 years old. So these children spend their first 3 years coming to the hospital 3 times a week, being connected to the artificial kidney, to the dialysis machine for 4 hours. So when you enter our pediatric dialysis unit, you could see a traditionally clad mother sitting near her Arab child, a Muslim mother, fully covered, and a teacher employed by the hospital, teaches in Arabic this child. And in the next armchair, connected to the next dialysis machine, an ultra-Orthodox mother with her traditional clothing, talking to her son in Yiddish. And the teacher teaches him or her in Yiddish. And this couple, the Muslim mother and the ultra-Orthodox mother, united by the cruel fate to have a baby born with kidney diseases, they spend 12 to 16, it takes time until you are connected, and after that, about 16 or 17 hours a week sitting next to each other. So this is one story where coexistence is practiced within the frame of the hospital.